The problem that we have with respect to Medicare is not so much that it reduces the liberty of a few of us, it's that it's an enormous subsidy to many people. So the reason you find people marching there with such eagerness is they spend $1 of their own in order to get $8 from everybody else. That's a program you can't resist signing up. But it's also extremely important to understand that there is a vast difference in this thing. This goes to what the Secretary says between health care and health outcomes. There's been a lot of research on this issue done lately, and in fact the Robert Wood Johnson Foundation, no paradigm of the right, has finally concluded that most of the stuff having to do with health outcomes has relatively little to do with health care. It has to do with levels of alcoholism, levels of various kinds of abuses, obesity, smoking, all sorts of other things that take place long before you get into the health care system. And therefore, in order to make these international comparisons, you really have to control for that, levels of violence and other sorts of things. And here's the way in which I would put it. Take what Secretary Bigby says. We have spent more money on health care, much of it coming through these government programs, with a worse set of accidents, of outcomes than you get in other places. It's not quite right, but it's close enough. Why would you want to increase the level of government spending if, in fact, you have no promise whatsoever that you're going to be able to reverse these things? What you do when you tax is you take money that people could spend not on health care as such, but on a new set of tires, on an evening out on the town, or whatever it is, much of which will improve their health care. The optimization problem we're trying to solve is to keep people out of the health care system as long as we can, and then care for them in it. If we put all the money, once they're in the system, we become experts in intensive care, and what we do is we lengthen their life in the emergency room for a week, and we shorten it for a year by making them having less resources to do other things. So you've got to look at it globally.
More than half of what we spend on health care in this country is spent privately. The governments, all governments together, are just under 0.5% of total spending. So why hold the government completely responsible for all the flaws that you see in health care when we have half of it private?
Because the way the money is spent is in large sense today dictated by the kinds of regulations for which you have to do compliance. So that if you have a health care mandate that you must cover certain kinds of things, it's privately expended and government directed. And that's the kind of thing that you have to worry about. And if you want to do these comparisons to Switzerland, it's not about yodeling. It's about the question of whether they have the same rules on neonatal care that we provide. It's, in fact, a more dramatic situation. You could spend a fortune on health care to keep somebody alive at $100,000 for an extra week, or you could put it into school lunches and you can manage to keep children alive for a very long period of time. We don't make any sensible comparisons across field. And as to education, we spend more on that than everything else, and we mess it up beyond all recognition as well. So again, the areas in which we have the strongest set of public rights, we have the worst level of performance. You could do one of two things. Either you could have positive rights imposed upon you by government, or you could actually get the services somewhere else. And by and large, whenever I hear somebody says we're going to guarantee you something, I think that they're not going to know how to provide it, but they will figure out how to tax somebody else in order to make sure that those services will go through government.